Hello and welcome back to our channel. Today, we're diving deep into a crucial health topic: how smoke affects eyesight. We often hear about the detrimental effects of smoking on our lungs and heart, but the impact on our vision is equally alarming and often overlooked. This video is packed with scientific evidence and statistical data to provide you with a comprehensive understanding of how smoke can damage your eyes and what you can do to protect them. Remember, this video is for educational purposes only, so always consult with your healthcare provider regarding any medical concerns. Understanding the components of smoke. Smoke, whether from cigarettes, wildfires, or industrial pollution, contains a complex mixture of chemicals. These include carbon monoxide, nicotine, tar, and a variety of toxic metals like lead and cadmium. Each of these components can have detrimental effects on various parts of the body, including the eyes. Scientific evidence. A study published in the Journal of Ophthalmology found that tobacco smoke contains over 7,000 chemicals, many of which are toxic to the eyes. Among these, heavy metals like lead and cadmium have been shown to accumulate in the lens of the eye, potentially leading to cataract formation. Statistical data. According to the World Health Organization, WHO, approximately 1.1 billion people worldwide smoke tobacco, exposing not just themselves but also those around them to harmful secondhand smoke. This widespread exposure significantly raises the risk of eye diseases on a global scale. Smoke and dry eye syndrome. One of the most common and immediate effects of smoke exposure is dry eye syndrome. Smoke irritates the delicate tissues of the eyes, leading to reduced tear production and increased tear evaporation. Scientific evidence. Research published in the American Journal of Ophthalmology found that smokers are twice as likely to develop dry eye syndrome compared to non-smokers. Another study in investigative ophthalmology and visual science showed that exposure to secondhand smoke can decrease tear film stability and increase ocular surface inflammation. Statistical data. The prevalence of dry eye syndrome in the general population ranges from 5% to 34%, but among smokers, this prevalence can be as high as 50%. Smoke and cataracts. Cataracts, a condition characterized by clouding of the eye's lens, are one of the leading causes of blindness worldwide. Smoke exposure accelerates the development of cataracts through oxidative stress and the accumulation of toxic substances in the lens. Scientific evidence. A landmark study in the British Journal of Ophthalmology found that smokers have a 60% higher risk of developing cataracts compared to non-smokers. The study highlighted that the risk increases with the number of cigarettes smoked per day and the duration of smoking history. Statistical data. Globally, cataracts account for 51% of blindness, affecting approximately 20 million people. Among smokers, the incidence of cataracts is significantly higher, underscoring the need for targeted prevention strategies. Smoke and age-related macular degeneration, AMD. Age-related macular degeneration, AMD, is a severe eye condition that affects the central part of the retina, macula, leading to loss of central vision. Smoking is one of the most significant modifiable risk factors for AMD. Scientific evidence. A study published in the Archives of Ophthalmology revealed that smokers are up to 4 times more likely to develop AMD compared to non-smokers. Furthermore, the Blue Mountains Eye Study indicated that the risk persists even after quitting smoking, although it does decrease over time. Statistical data. In the United States alone, AMD affects approximately 11 million people, and smoking is responsible for up to 25% of these cases. This statistic highlights the critical impact of smoking cessation in AMD prevention. Smoke and diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the blood vessels of the retina. Smoking exacerbates the risk of developing diabetic retinopathy by increasing oxidative stress and inflammation. Scientific evidence. Research in the Journal of Diabetes Research found that smoking accelerates the progression of diabetic retinopathy by impairing blood flow to the retina and increasing the formation of advanced glycation end products, AGEs. Another study in diabetic medicine reported that smokers with diabetes are more likely to develop severe retinopathy compared to non-smokers with diabetes. Statistical data. Globally, diabetic retinopathy affects about 1/3 of all people with diabetes, which translates to roughly 93 million individuals. Smoking significantly increases the risk, with smokers having a 30% higher likelihood of developing this condition. Smoke and optic nerve damage. The optic nerve transmits visual information from the eye to the brain. Smoke exposure can lead to optic nerve damage, resulting in vision loss or even blindness. Scientific evidence. A study in the Journal of Neuro-Ophthalmology found that smokers are at a higher risk of developing optic neuropathy, a condition characterized by damage to the optic nerve. This is due to the toxic effects of chemicals in smoke, which can impair blood flow and oxygen delivery to the optic nerve. Statistical data. Optic neuropathy affects approximately 1 in 12,000 individuals worldwide, and smoking increases this risk by up to 16%. Smoke and retinal vein occlusion, RVO. Retinal vein occlusion, RVO, is a blockage of the veins carrying blood away from the retina, leading to vision problems. Smoking is a significant risk factor for RVO. Scientific evidence. The Beaver Dam Eye study reported that smoking increases the risk of RVO by promoting blood clot formation and damaging the vascular endothelium. Another study in the Journal of Thrombosis and Hemostasis found that smokers are twice as likely to develop RVO compared to non-smokers. Statistical data. RVO affects approximately 16 million people globally, and smoking contributes significantly to the incidence of this condition. Smoke and uveitis. Uveitis is an inflammation of the middle layer of the eye, uvea, and can lead to severe vision loss. Smoking is a known risk factor for uveitis. Scientific evidence. A study in the American Journal of Ophthalmology found that smokers have a 2.2 times higher risk of developing uveitis compared to non-smokers. The study suggests that smoking-induced immune system alterations may contribute to the development of uveitis. Statistical data. Uveitis accounts for approximately 10% of all blindness cases in the United States, affecting about 38,000 people annually. Secondhand smoke and eye health. Secondhand smoke exposure is also detrimental to eye health. Non-smokers exposed to secondhand smoke are at risk of developing various eye conditions, including dry eye syndrome, cataracts, and AMD. Scientific evidence. A study published in Tobacco Control found that individuals exposed to secondhand smoke have a 30% higher risk of developing AMD compared to those not exposed. Another research in the Journal of Ophthalmology showed that children exposed to secondhand smoke are more likely to develop allergic conjunctivitis and dry eye syndrome. Statistical data. The Centers for Disease Control and Prevention, CDC, estimates that about 58 million non-smoking Americans are regularly exposed to secondhand smoke, significantly increasing their risk of eye diseases. Strategies for protecting your eyes from smoke. Protecting your eyes from the harmful effects of smoke involves both lifestyle changes and proactive measures. Here are some strategies to consider. Number 1. Quit smoking. The most effective way to protect your eyes from smoke-related damage is to quit smoking. Numerous resources and support systems are available to help you quit. Number 2. Avoid secondhand smoke. Stay away from environments where you might be exposed to secondhand smoke. This includes public places, cars, and homes where smoking is allowed. Number 3. Use protective eyewear. When in smoky environments, consider wearing protective eyewear to reduce irritation and exposure to harmful chemicals. Number 4. Maintain a healthy diet. Eating a diet rich in antioxidants, vitamins, and minerals can help protect your eyes from oxidative stress. Foods like leafy greens, fish, nuts, and fruits are excellent choices. Number 5. Regular eye checkups. Regular eye examinations can help detect early signs of smoke-related eye conditions. Early intervention can prevent the progression of these diseases. Number 6. Use artificial tears. If you suffer from dry eyes due to smoke exposure, over-the-counter artificial tears can help keep your eyes lubricated and reduce irritation. Conclusion. The impact of smoke on eyesight is profound and multifaceted. From dry eye syndrome to severe conditions like AMD and diabetic retinopathy, the evidence is clear. Smoke is detrimental to eye health. By understanding these risks and taking proactive measures, you can protect your vision and maintain healthy eyes. If you found this video informative, please give it a thumbs up and subscribe to our channel for more health-related content. Don't forget to click the notification bell to stay updated on our latest videos. And as always, consult with your healthcare provider for personalized medical advice. Thank you for watching, and take care of your eyes.